Good day, ladies and gentlemen. Hello, dear friends. My name is Vasyly Rohovyy. I am the hand transplant patient from Innsbruck, Austria, and the founder of the Voice of VCA Patients. Welcome to the interview. This time our guest is Professor Nadey Hakim, the pioneer in kidney, pancreas, and composite tissue transplantation. Professor Hakim is Professor of Transplantation Surgery at Imperial College London, the President-elect of the TTS, the Transplantation Society. Good day, Professor Hakim. Nice to see you.
Nice to see you, Vasyly. Very nice to see you. And I'm so happy you're looking so great.
Thank you very much. Professor Hakim, I am very grateful to you for participation in the patient initiative Raise Awareness about VCA. Many thanks for your time. Professor Hakim, you were one of the key members of the international surgical team that performed world's first unilateral hand transplant at Edouard Herriot Hospital in the city of Lyon, France, in September 1998. Professor Hakim, could you tell our viewers, please, the story about the establishing of the Lyon hand transplant program and what motivated you to get involved in it? That was a very controversial surgery at the time.
Yeah, indeed, I was part of that multinational team who performed the first arm transplant. But there's an introduction to this because initially the patient in question he was supposed to be done in London at my hospital, at St. Mary's Hospital. And I was introduced to the patient by Earl Owen, who is the leader of the whole team. And at that time, a year or two before, Professor Owen was the president of the International College of Surgeons, of which I was member of council. And he said to me, I'd like to do the first ever arm transplant in the world. At that time, I have to admit, I was not even knowledgeable about the idea. I thought he was joking. He said, no, 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 I would like to do it. I would like to be part of this because you are a transplant surgeon and I'm not. I'm a microsurgeon and I need a transplant surgeon on the team. So I said, of course, I'll be delighted. And then we tried to get permission to have this done in London, but the ethics committee in London, as you mentioned, there was a lot of controversial opinion about it. They said, sorry, we can't allow this to happen. And because we were in a hurry to do it, because we did not want anyone else to do it first, we then had the idea to contact Max Dubernard in Lyon. And this is why it ended up being performed in September 1998 in Lyon by the team, which came from France, Italy, Australia, and myself from the UK.
Yes,
This is what happened.
I didn't know about that the transplantation should have been done in London. Thank you. Professor Hakim, could you tell our viewers, please, about the part of the surgery you took on? What were your key responsibilities in the operating room? And maybe do you remember how long did it last, the surgery, and how many of medical staff took part in it?
Yeah, you see, as a transplant surgeon myself, we deal with joining vessels together. And my contribution after having had the orthopedic surgeon join the bones together is to take part in the vascular anastomosis, which was done with the electronic microscope. So this was my specialty, and that's what I do, whether it's kidney, pancreas, small bowel, or any other transplantation. In addition to this, obviously, you need the orthopedic surgeon, you need the neurosurgeon to join the nerves together, and obviously muscles, tendons, etc. All this requires the input of many different specialties. But before all this has to happen, you have to select the patient. You have to think about which immunosuppression to give. And this again was my contribution to the transplant, because you can put together an organ, but you need
Mm-hmm.
to prevent rejection. And this is
Yeah.
what my input was to answer your question properly.
Mm-hmm. Mm-hmm. Professor Hakim, you have partially answered my next question, but I think it is a mystery, so to say, why Mr. Hallam, the patient from Australia, not someone from France or United Kingdom, was chosen for the surgery. And what impression did he make on you at your first meeting? I mean, was his motivation strong enough to undergo the hand transplantation?
I think the answer, Vasily, to your
Mm-hmm.
question is that undoubtedly we owe Clint Hallam a lot. I mean, you went through this surgery, and you
Yeah.
know how demanding this is for your mental health.
Mm-hmm.
For someone to come forward and say, "I want this done, and I really, really want to be the first ever to have this performed," is by itself a commitment which not many people would go through, because it's major. So
Life
the
commitment.
answer to your question, why select an Australian? It could have been a Russian, it could have
Mm-hmm.
been a Latin American,
Mm-hmm.
whoever comes through the door and knocks on your door saying, "I want to be the one." And
Mm-hmm.
it's thanks to him who knocked on the door of Earl Owen that we ended up doing it. You see, this is
Mm-hmm.
the answer. It's not
Mm-hmm.
that we select X, Y, Z. No, the X was Clint Hallam. He knocked on the door of Clint, of Earl Owen. Earl Owen organized the whole thing, and this is what happened.
Yeah. Thank you. Mm-hmm.
And I still think it was the right choice, despite the fact that 2.5 years later he stopped taking medications. This is another story. But
Mm-hmm.
we owe him still the courage to have something done which no one else had done in the world.
Yeah. Yeah.
This is what we're talking about.
Yeah. It is always hard to be the first. Yes. Yeah. Professor Hakim, it is well known that the transplanted hand was amputated in London in 2001. Um, could you explain to our viewers, maybe potential hand transplant candidates, why Mr. Hallam made the decision? I think it will help potential candidates uh, to avoid that disappointment or failure if they know about why he made the decision. Could you?
Well, the answer, Vasily, is very simple.
Mhm,
When you are not supported by your country, by your government, by your national health with the immunosuppression required, which is very expensive, this
mhm,
guy had no job.
mhm.
He was not French, he was not English, he was not Australian, he was a New Zealander. He did
New
not
Zealand.
live, he did not live in New Zealand where he could have had the money required to pay for his drugs.
Mhm,
So initially, I was the one supplying him with all the medications because I had friends in the pharmaceutical companies supplying me free of charge the drugs. But at one point, he ran out. How can you pay? How can you pay
mhm,
for this? So it is not that he did not want the arm anymore. No, he stopped taking his medications. And when
mhm,
I saw the status of his arm, which was in a disastrous condition, which could have caused his death and led
mhm,
to his death, I took the medical decision, surgical decision, human decision to amputate that arm. He had gone to see the French surgeons in Lyon a month earlier, and they said, "No, no, no, keep it, carry on, etc." But I have to say, with all due respect, the team in France, this was not the right decision. You needed to save the life of the patient. The arm is gone, finished. Let's talk about the patient, the human we have in front of us. And this applies to any other organ. It could be a kidney which failed, it could be liver, it could be lungs. You have to save the life of the patient, not the organ. The organ, of course, is important, but not as important as the life of the patient. Therefore, I took the decision on that Friday of, I can't remember which month, in 2001, to
Mm-hmm.
remove that limb, to amputate the arm in a private hospital in incognito. No one knew about it because, and I was very fortunate to have a hospital where they did not even charge me or the patient for the having the surgery because I knew the chief executive. And
Mm-hmm.
it worked very well. I amputated the arm, the wounds healed very nicely, and he was out within 2 days, 3 days, which was a miracle. I've never done a below elbow amputation in my life. I've done below knee. I've never done this operation before. I'm not the one who put the screws together. And indeed, during that day, I had to find instruments to remove the screws in a hospital which does not do orthopedic surgery. So
Mm-hmm.
I still managed, and you have to remember, this is, we talk about 27 years ago. I
Yeah.
was much younger,
Yeah.
but I did improvise and thank God succeeded in saving the life of the patient.
Yeah. Thank you. Yeah. Professor Hakim, did Mr. Hallam get in touch with you and you helped him, so to say, voluntarily? Yeah. Uh,
Exactly. He
yeah.
contacted me and a week earlier, he was in Loma Linda in the US about
Mm-hmm.
to have it amputated. And then last minute, the Americans said, no, no, we can't do it. So he came to London and he begged me. He said, please come and have a look at it and you'll decide yourself. I went, I knocked on the door of his hotel, and here he was with a
Mm-hmm.
dead hand. I mean, it was terrible.
Yeah. Yeah. It is a really tragic story. Professor Hakim, can it be said that the first failed hand transplantation was a severe setback to the field of VCA in general? And if yes, what helped you and your colleagues to overcome the challenge? Was it the medical needs of your patients, their motivation, or the engagement of their doctors, or all together, or something else? Could you share your thoughts
Yeah,
on this matter?
I would say, Vasily, no, it was not a setback at all.
No. Mm-hmm.
This happened 2.5 years after the transplant. If you compare it to what happened to the first ever heart transplant, the patient died after a few days, but it was still a success because that was the first ever heart transplant in the world in South Africa, as you remember, by Christian Barnard. This
Mm-hmm.
was a success. If you compare the arm to the success, if you call it success of the heart transplant, of course, this is a big success because 2.5 years later, none of ours failed because medications are not given, you fail. But the procedure itself was successful. The first few, let's say 2 years, he had a functioning arm. What
Mm-hmm.
happened the last 6 months of the arm being attached is we know what the reason was.
Mm-hmm. Yeah, understand. Yeah, thank you. Professor Hakim, and what needs to happen to bring more attention and interest to VCA from the medical community to grow understanding and potential for executing in VCA around the world? It would be interesting to know your opinion on this matter.
I think the more we organize meetings, symposiums, such as the one where we met in Helsinki,
Yeah.
or the VCA
Mm-hmm.
meetings, the better. I think we ought to make the results visible to more people at meetings. Uh, I'm, as you mentioned, the president-elect of the Transplantation
Yeah.
Society, and we are hopefully going to have many more sessions on the VCA
Mm-hmm.
within our meetings, the future meetings. And I think this is what it is. And we have to highlight the successes. When we met in Helsinki, I think the figure of 165 arm transplants performed worldwide was mentioned. Maybe
Hmm.
now it's more, undoubtedly more. So this is what we have to highlight, and this is what I think the future will show, that this is a viable option for people who are eligible, people who are willing to take the immunosuppression religiously and
Hmm.
be a success such as yourself.
Yeah, 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 you're right. Professor Hakim, I think we can mention that the next TTS meeting takes place
In
in
Sydney in September.
yeah, yeah. You will take part in it, yes?
Yes, because that's when I become president
Hmm.
officially. 'Cause I'm the president elect now. Yeah, correct.
Hmm. Yeah. Professor Hakim, you also played a very significant role in setting up the first hand transplant program in the UK. If I'm not wrong, the first hand transplantation was performed in Leeds 2012.
Yeah, actually, I was not involved at all with the transplants in Leeds. I think Leeds is a complete different um, team. I was only involved with the first two transplants performed in Lyon.
Mhm.
The Leeds team they've done a fantastic job, and I'm very grateful to all their efforts. But to correct you, no, I was not involved with the UK team at all.
Excuse me, false information. Sometimes it happens. Yeah, Professor Hakim, we have mentioned it, your colleague, Professor Jean-Michel Dubernard. Yeah, you knew him very well and worked together for many years. As we know, Professor Dubernard passed away a few years ago. May I ask you to share your memories of him? What kind of person and colleague he was?
Yeah, I mean, Max Dubernard was indeed a very good friend of mine.
Mhm.
We both are pancreas transplant surgeons. He performed the first pancreas transplant in France, and I performed the first pancreas transplant in London. So that's how we collaborated. And actually, funny enough, you mentioned him. On my desk, I always have his picture with the second arm transplant. You see, I can show you that. See,
Mm-hmm.
this is
Yep.
when he came to visit me in London.
Mm-hmm.
So I always keep this picture on my desk because I have a lot of respect for Max Dubernard. We call him Max.
Yeah.
It is Jean-Michel, but he used to be called Max Dubernard,
Mm.
who sadly died of a heart attack while he was at the airport in
Report.
Istanbul.
Mm-hmm.
Yes, yes.
Yeah. Mm-hmm. Uh, Professor Hakim, you have called him Max. Why? May I ask you? It is.
I think that's what he used to be called always, Max. Jean-Michel was the official name, but I think to his friends and colleagues, he used to be called Max.
Mm-hmm. Yeah, very interesting. Yeah, Professor Hakim, you are well known not only as an excellent surgeon, but also as a prominent sculptor. I think this profession have something in common. They both involve shaping and restoration of body parts. May I ask you, have your interest in art helped you in your work as a reconstructive surgeon?
Certainly, I think as you mentioned, there is a lot of similarities between transplantation and sculpting. When you sculpt, you're trying to clone the face of someone, and I think when you are transplanting, when you are doing a transplant as such, you are replacing a lost organ with
Hmm.
something which hopefully will look similar and will function the same. And I think there's a lot of similarities between the two professions. I consider myself a sculptor at night and a surgeon at daytime because that's how I do it. And I think uh, one thing I know is that sculpting, if anything, is more difficult because when you do a transplant, when you do any other surgery, things heal by themselves, correct? I mean, the skin, when you had your surgery, it was closed, and then within a week or so, it has sealed, it has glued together. But when
Mm-hmm.
you do it, a sculpture, it is the way the artist has finished. It will remain that way forever. Nobody's going to come and fix it for you. That's why you have to be perfect even more in the world of sculpture and the world of sculpting than
Mm-hmm.
in the world of surgery.
Mm-hmm. Yeah.
That's how I look at it.
Yeah, Professor Hakim, thank you very much for your open and interesting talk. I am very grateful to you for supporting the patient initiative Raise Awareness about VCA. I wish you success in your work and art, and I
Thank you
hope
so
to
much,
see you.
Vasily. And
Yeah.
I'm very proud of you. And thank you so much for keeping the torch light with your fantastic work and your successful story. Well done.
Thank you. Thank you very much,
Bye bye.
Professor Hakim.
Take
Yeah, have a
Thank
nice
you.
day. Goodbye.
Thank you so much. Bye bye. Bye bye. Bye bye. Bye bye.